This is a video in clinical medicine from the New England Journal of Medicine.
Evidence suggests that the risk of major central venous line complications, particularly line-related bloodstream infections, is lower when the subclavian approach is used. This video will identify the landmarks and procedure for placement of a subclavian central line. To assure that there is the highest level of sterility, the operator should wear a sterile gown and gloves, as well as a surgical cap, mask, and face shield. Most of the equipment can be found in commercially prepared kits and should include skin preparation solution, 1% lidocaine, non-luer lock or slip-tip syringes, a number 11 blade scalpel, saline or heparinized flushing solution, a catheter with the appropriate length and number of lumens, a compatible skin dilator, usually 1 French larger than the line, an appropriate sized needle, a guide wire of compatible size, which will pass through the catheter and needle, suture, and a needle driver. If there are no contraindications, proceed by placing the bed in a 10 to 15 degree Trendelenburg position to decrease the risk of air embolism and to engorge the vein. Turn the patient's head so that the chin points away from the vein. Using the insertion needle, approach the site at a 30-degree angle to the skin, with the long axis of the needle directed toward the sternal notch. Puncture the skin just lateral to the middle third of the clavicle. Continue to aim toward the sternal notch with the needle tracking just beneath the clavicle, avoiding penetration into the deep tissues of the neck. Typically, the vein is accessed immediately beneath the clavicle, although needle penetration under the skin may reach several centimeters. An assistant should watch the monitor, looking for signs of arrhythmia during advancement of the guide wire. Arrhythmias indicate that the wire has reached the heart. If arrhythmias occur, withdraw the wire slightly until they cease. After the guide wire has been inserted, withdraw the needle, leaving the guide wire in place. A central venous line is a convenient and often necessary tool in the treatment of the critically ill patient. However, one must always be aware of the potential for problems